All right, we're going to go ahead and get started. Thank you everybody for joining this morning. If you are here for the webinar on health disparities in education, you are in the correct place. Today's webinar is going to be about an hour long from 9 to 10. So let's go ahead and get started. If you are new here, a little bit about the 2B unit at LACO. We offer services to all 80 LEAs in LA County. Some of those services include building capacity, training staff, SRO, giving PDs and training on various different topics that have to do with tobacco use prevention and vaping. We also provide educational materials and other services. We basically really meet you where you are. So if you have any questions, our information is down at the bottom to be at laco.edu. You can email us or you can visit our website. Our unit is, of course, me. I'm a senior program specialist here. We have joining us today Mark Hernandez, who is our program coordinator, and he will be managing our chat today. And we also have with us Derek Reed, who is our other senior program specialist who oversees our Tier 2 grant, if you are familiar with that. So they will be here helping us answer questions, manning the chat. So at any point during our presentation today, if you have questions, if you have comments, please drop them in the chat. Mark will be answering them. He's probably the best person to answer them while I am giving the presentation. He'll probably know the answers better than I would. So today, our agenda, we're going to talk first about health disparities, right? Just kind of a general overview. What are health disparities? What do they look like? What is it? Kind of that 101. Then we'll talk a little bit about health disparities in terms of tobacco use, tobacco marketing. And then we're going to get into the nitty gritty of health disparities in schools. What does that look like in our schools, with our students, with our youth? And then finally, our closing. All of the fun resources, links, information that I have to offer you that you can walk away with and hopefully use in this work that we do of tobacco use prevention. Before we get started, however, I do want to point out that today's discussion will be about tobacco, but we are going to be focused on commercial tobacco. This is not to be mistaken or confused with the usage of tobacco for religious or ceremonial usage by American Indians and indigenous communities. We recognize that tobacco can be used as a sacred thing within those communities. But what we're really focusing on is the commercial tobacco that is mass produced. It's sold for a profit. It contains, very addictive chemicals. And that's really what we're focusing on today. So with that said, let's start off with health disparities. What is that? How do we look at that? What are the factors of health disparities? So first, let's talk about health equity. Health equity basically just means that everyone has a fair chance at being healthy, as healthy as possible. And this includes being free from commercial tobacco, right? Again, we are looking at health disparities today through a tobacco use prevention lens. And so that also includes our youth, our adults, just people being free from commercial tobacco use. Some factors that play into health equity are things like race, ethnicity, location, jobs. These things can limit this opportunity for people to have health equity. Health inequity, which is often referred to as health disparities, which is what we will be using throughout the presentation today. This is really reflected to the differences between various different components: length of life, quality of life, rates of disease, disability and death, the severity of diseases, access to treatment. These are avoidable differences in health status between groups of people. Um, they persist when when the distribution is unfair. Again, poverty is another determinant. And speaking of determinants, these health disparity or health inequity and health equity really depends on the social determinants of health. These are basically the conditions of our environment, conditions of where we live, where we learn, where we play, where we work. And these really shape our well-being. In turn, they are determined by the distribution of wealth, power, and resources. So we can think of different factors such as economic stability, social and community context, our neighborhoods and our environment, our healthcare or access to healthcare, or even access to high quality healthcare and education. Some studies even draw strong correlations between the education of parents and the health of children. The less education, usually the unhealthy the children are and the family. And so all of these play a role in health equity and health inequity. I personally am a visual person. So I really love this sort of graphic, what to know about health disparities. We know that it can last for generations. If these social determinants keep occurring, then the cycle continues. We know that it's perpetuated by discrimination and income inequity. We also know that closing the gap requires addressing social determinants of health. Again, all of those aspects that we just went over in terms of where we live, where we work, where we play, and differences in health linked to social or economic disadvantages. So again, it's sort of this never-ending cycle that can last generations. So what does the research say? Well, research has revealed that social and economic disparities in access to healthcare and insurance coverage for students and their families. So these gaps in access to care also exist for individuals depending on their potentially intersecting categories, which we will get into a little bit further into our presentation today. But these categories can be disability status, language proficiency, immigration status, sexual orientation, and those who are living in rural communities. When we're talking about schools, which again, we will get into later in our presentation, one way that policymakers, especially in California, have sought to expand equitable access to healthcare is through the community schools. This is one way that schools are trying to close that gap of these social determinants in order to assist not only students, but their families. Um, I currently to coming to this position was a classroom teacher for 10 years. I worked during the COVID era. I worked in a working class community. And when we're talking about access to healthcare, access to insurance coverage, what we saw in our schools a lot were students who were missing school because they either A, did not have access to healthcare or insurance. And so when getting symptoms, going to the doctor was not always the first choice because sometimes going to the doctor cost money. And this may have been money that families didn't have. And so if those symptoms worsened and the student got sicker, they'd have to miss school, right? Or missing school also meant not being able to go to the doctors or go to an urgent care because there either was no insurance or there was no money to do so. And so we can see how this kind of trickles down into not having access to healthcare, insurance coverage, circumstances of these families. So when we're talking about tobacco use, right, we're talking about disparities in terms of tobacco use. Tobacco remains very, very high under the characteristics of some of these disparities. We can see here in this chart that tobacco use is very, very high in those who say are identifying as lesbian, gay, or bisexual, low income, rural residents, psychological distress. So maybe this is more of a self-medication type thing. Black or African communities. This is just one small indication that tobacco use is high within these disparity groups for one reason or another. So that brings us to our next topic. Let's talk about health disparities and tobacco use. As you can see here, very, very old advertisements. However, we can see how these advertisements are targeting certain communities, right? They are making smoking or cigarettes look fun. These are young, healthy people in these advertisements. They are targeting these communities, right? African American community, Latinx communities. They are making this look fun, healthy, something to desire. And so we're going to talk a little bit about how using these social conditions in tobacco marketing is really targeting these communities. Once again, I'm a very visual person. I love sort of this breakdown of different types of people. And we're really talking about those social conditions, right? Social conditions such as discrimination, poverty. These are all associated with commercial tobacco use. And this is another reason why it can make it harder to quit, because these different social conditions, these categories, these people are being targeted by tobacco companies. So let's take a quick look at this infographic. This is 8 ways tobacco affects vulnerable people. First, 71%. Tobacco use is 71% higher among adults with mental illness. Again, we're talking about self-medicating, right? Finding coping skills that may not be healthy. Tobacco use is over 50% higher among LGBTQ adults, 35% higher among American Indian and Alaska Natives, 215% of Asian American men smoke at a higher rate than Asian American women. 1.5 times as many Hispanic middle school students report using tobacco compared to their middle school students. African Americans smoke menthol flavored cigarettes at nearly 3 times the rate of white and are more likely to die from smoking related illnesses. 22.4% of people in remote areas smoke versus 14.7% of their urban counterparts. So these rural areas, right? And finally, tobacco use is 310% higher among homeless adults compared to the general population. So once again, you can see how these vulnerable communities, these vulnerable groups of people are seeing higher rates compared to their counterparts, right? So here's where I ask for your participation. Given all of these statistics, what is one data point that you found surprising? Go ahead and drop it into the chat just to share. We also like to take some of this information just to kind of see what our participants are sort of honing in on. What is one data point that you found surprising? I will show you the data points again. Personally, I think one of the data points that I found surprising, probably because it's the highest, 310% higher usage among homeless adults for me. That seems like a lot. So go ahead and drop in the chat. Which data points did you find the most surprising? Maya, yes, same. I found that to be really surprising. Some of these I feel in the work that I do were expected, but some of them I find to be interesting. Yes, 50% higher among LGBT adults. Yes, adults with mental illness. That's another one that it just seems like such a high number. All right, yes. Thank you. Thank you, everyone, for your participation. I almost sometimes feel that like a lot of these are surprising, right? Because we know that maybe these groups are being targeted by tobacco companies, but we don't know what that real data looks like, right? How successful are they? So let's take a look at this chart. I have obviously blocked out a lot. That's why you see a lot of white space. But you can tell that this is a chart of African American mortality chart comparison. What I would like for you to do is take a guess. Take a couple of seconds to look at this chart. And what do you think each green bar is a data point of? Go ahead and drop your 3 guesses in the chat. What do you think these 3 green bars are data points of when it comes to African American mortality chart comparison? One might be a very, very obvious answer because of the topic of today's presentation. What are the data points that you think contribute mostly to the mortality of African Americans? Good guess. Yeah. Stroke, cancer, smoking. Okay. In that order? Or maybe just no particular order? All right. This one I also found very surprising. I think just because we can see one of those data points is by far bigger than the others, right? Mental illness, tobacco use. Okay, so when it comes to African American mortality, what we are actually seeing is tobacco deaths are, again, by far the largest data point. And then you have homicides and AIDS. This is just one indication, right, that African Americans are targeted by tobacco companies. And unfortunately, tobacco companies are doing a great job at that because we can see here that tobacco deaths are the leading cause, right? So I've got a quick little video for you just to kind of break up some of me talking. So let's take a look at Truth Campaign's message on African American tobacco usage.
For decades, Big Tobacco targeted minorities with menthol cigarettes. Here's some of what they did. Identified and profiled black communities.
More than 75% of African American smokers use menthols.
Appropriated black culture. Flooded the neighborhood.
Can't get away from it. It's all around us.
This addiction was designed.
We grow cigarette volume, and that's all we did.
And today, 89% of African American smokers use menthols. Know the truth, spread the truth. For decades.
So just reiterating a little bit about what was said, a high amount of Black smokers are using menthol cigarettes. And this actually menthol cigarettes makes it easier to smoke because of the menthol in it. It's not as harsh on your throat and, on your breathing, but this can also make it harder to quit. Um, the tobacco industry strategically and aggressively targeted these communities with menthol cigarettes for decades. You saw in the very quick video, flooding their neighborhoods, all of their advertisements, appealing to the Black community. There's more advertising in predominantly Black neighborhoods, the publications that are popular to Black audience. Tobacco companies appropriated Black culture in marketing. This includes sponsoring events like jazz events and hip hop festivals. Menthol has also repeatedly been exempt from legislation on flavored tobacco products. And this is a result of massive tobacco industry lobbying efforts. Now, this is more federally, like nationally. Here in California, maybe January? No, almost a year ago. Here in California, there is a ban on flavored tobacco products. This also includes menthols. So here in California, you are unable to buy menthol cigarettes. However, speaking personally to people I know, friends and family members, that does not mean that you can't get menthol cigarettes here in California. It's probably harder, but they are still sold throughout the country and in other states. And so even though California has outlawed flavored tobacco products such as menthol cigarettes, there is still a way to get them. Now, pivoting on a different community, right? LGBTQ plus community are also treated in the same way in that they are targeted by the tobacco companies. 3.5% of Americans identify as lesbian, gay, or bisexual, while 0.3% identify themselves as transgender. Here in California, specifically talking about students and youth, a little over 10% of California students in public and middle high schools identify as LGBTQ. And the LGBT community belongs to almost every race, ethnicity, religion, age, and socioeconomic group. So when we're talking a little bit about, let's say, tobacco companies targeting different ethnicities, now also think about if those people or parts of those ethnicities are also identifying as LGBTQ, right? The LGBTQ plus community has a higher risk of substance use, sexually transmitted diseases, cancers, cardiovascular. Again, if we are talking about health inequity and health equity, these are all components that are going to affect these communities. The other thing is that the LGBTQ plus community receives poor quality of care due to stigma, lack of healthcare providers' awareness, and insensitivity to the unique needs of the community. So let's say that someone whose sex assigned at birth was female, but they identify as otherwise, they may not feel comfortable disclosing their full health history, or they disclose disclose that information to their healthcare provider, but their healthcare provider is biased and does not administer the highest quality of care, right? So this also puts this community at risk. And again, tobacco companies target through advertisements, same thing, sponsoring different events that LGBTQ pride events, things like that. And this makes it very difficult not only to resist, right, but also to quit. 3 in 10 LGB youth currently use electronic vape products such as e-cigarettes. This is 25% higher than their heterosexual youth counterparts, right? More than half of LGB youth have tried e-cigarettes. Now, tried versus currently using, that's always a win. But once again, the fact that 25 or half have tried mean that these advertisements and this targeting is working. So let's talk a little bit about intersectionality of identities. The more compounded the marginalized identities there are, the bigger the gap is between health equity and health inequity. What does that mean? Here's a great example. A student who is transgender, Black, and is a foster youth is more likely to use than not because of those compounding marginalized identities. So that brings us to this data point, right? Transgender youth of color use vape products at a higher rate than their cisgender and white counterparts. So again, when we're talking about these vulnerable communities, these vulnerable people, these different social determinants can also be compounded by their intersectionality and their different identities, which puts them at higher risk. So talking about youth, let's look at health disparities in schools. So when we're talking about health disparities today, again, we are looking through the lens of our work here at LACO. TUPE, which is the Tobacco Use Prevention Education Unit. When we're talking about health disparities, we're talking about student groups in our world as defined as students who are prone to higher usage of tobacco products due to their social determinants of health. So what does that look like? According to the California Department of Education, they have identified the following student groups as having a desperately high rate of tobacco use: African American and Black students, American Indian Alaska Native students, Latinx and Hispanic students, Native Hawaiian Pacific Islander students, students who identify as lesbian, gay, bisexual, transgender. You also have foster youth, students who are experiencing homelessness, students enrolled in non-traditional schools, which, if you know or not, non-traditional schools, we're talking about continuation schools, court and juvenile detention schools, independent studies, anything that is not your typical in-classroom environment. Rural communities and low-income communities. Again, when we're talking about some of our compounded, intersectionality, sort of that idea of belonging to more than one of these groups. Imagine a student who is American Indian, who is also, an LGBTQ student, who is also a foster youth living in a rural community. All of those determinants will somehow affect that student in terms of what their tobacco usage or how prone they are to using tobacco products. So how do these health disparities impact our schools, right? Why is it so important to bridge that gap? Why do we need to close that gap? Well, health disparities affects our dashboard, right? It affects attendance. If students are more likely to miss school due to some of these health disparities, whether that's access to transportation, their living situation, maybe illnesses, or again, medical access, this is going to affect our dashboard, but it's also going to affect the student, right? Because if a student is absent or chronically absent, that's going to affect their academic success. Missed learning opportunities can also equate to low test scores, fails, right? Not passing classes. This can also affect our graduation rate or the rate of dropouts. And this is going to decrease our graduation rates. Another thing that health disparities impact is behaviors in school. This can also lead to a high number of suspensions, expulsions, which again is just another vicious circle, right? If students are being suspended and they're being expelled, they are missing out on learning opportunities. They're missing out on academic success. They might be missing out on graduation. And so it's just kind of a vicious cycle, which is why we need to address our health disparities. So really quick, I have another question for you. We're going to go over some data points next, but I want you to take a moment. What grade in secondary classes, so 6th through 12th, what grade do you think has the highest rate of vaping usage in Los Angeles County currently? Go ahead and drop a number in. 7th grade, 11th grade, 10th grade. What grade do you think has the highest rate of vaping usage in Los Angeles County? Seventh, 10th, 7th. Okay, 6. Okay. So let's take a look at our California Healthy Kids Survey between 2021 and 2023. Now, 11th grade is going to be our highest. I know that here in California, we don't always reflect what the national numbers are. I know that the national numbers have gone up in the middle schools and down in the high schools. But here in California, according to the CHICS survey between 2021 and 2023, one of our highest is the 11th graders, which in a sense makes sense, right? The older you are, the more autonomy you have, the more access you probably have. But one theme that we do see a lot of is high numbers in our non-traditional schools. Once again, those are our continuation schools, our juvenile court systems, independent studies. And that in itself, right, can be an indication of maybe why are these students experiencing high numbers of usage? Are these students trying to self-medicate? These are students who might have some behavior issues, right? But there are some other determinants as well that we're going to look at in terms of vaping usage. So according to the same survey, students who said that they have a caring adult relationship in their life, right? We see that in the non-traditional schools, the highest number are those who say that they have less than pretty much true, basically saying that it is untrue that they have caring relationships in their lives. If you take a look at 7th, 9th, and 11th grade, those who say that they do not have a caring relationship in their life are more likely to are reporting that they are using more than one or more days in the past 30 days. Another data point, those who say that they experience chronic sadness. Now, when I say chronic sadness, this does not mean that today the student is sad because they just had a really bad day. They failed the test, they lost the game. Chronic sadness is more like students that experience maybe depression or sadness 30 days in a row or more. This is chronic sadness. It might be depression, it might be something else, but this is not your typical run-of-the-mill having a bad day, being really sad. And as you can see, those who experience chronic sadness are experiencing higher usage of vaping and smoking than those who do not experience high chronic sadness. Gender, we're seeing that there's higher numbers in those who are identifying as non-binary or something else. Really, really high numbers in non-traditional schools. Again, those who are identifying as something other than female or male are experiencing very high numbers. which brings us to gender identity. Those who are experiencing not sure in the non-traditional school setting are using cigarette smoking or vaping at 67%, right? These are students who are questioning their gender identity. They're not sure. Kids that are not sure are more at danger of using vape devices. Sexual orientation. Again, we can see that those who are identifying as not straight, so they're either gay, lesbian, or bisexual in all grades, are experiencing high usage of vaping. Once again, our non-traditional schools are having very, very high numbers, but you can see in 11th grade, those who are not straight, 12%, are experiencing vaping usage. 9th grade, 8%, as opposed to 4 and 5% are vaping more than 1 day or more in the last 30 days. Living situation, those who are experiencing homelessness. Take a look at 9th grade. Those students who are unhoused, 43% are smoking cigarettes or vaping 1 or more days in the last 30 days. Those who are in non-traditional schools who are experiencing homelessness, 41% are vaping or smoking. In foster homes, for instance, in 11th grade, 16% of students are vaping or smoking. We can see that those who, again, are home with 1 or more parent, probably the lower numbers that we're seeing. So definitely living situation for our students are going to be another indicator of whether they're prone to high usage of vaping or not. And one topic we tapped into a little bit earlier, race and ethnicity, right? Let's take a look at 9th grade. We're seeing the highest numbers in African American and Latinx students. 11th grade, American Indian, or more than one ethnicity are our highest numbers. Once again, non-traditional are our highest numbers out of all of the grades. Asian, white, 2 ethnicities, and Latinx are some of our highest numbers within non-traditional schools. So what does this all mean, right? If this is the data that our California survey is showing for our students here in Los Angeles County within the last couple of years, what does that really mean? What are we doing in our schools to address this? The 2024 California Children's Report Card gives a report card on all different aspects of what schools are doing in California and how well they are doing that. Specifically, when we look at health and we look at supporting mental health and preventing substance abuse, California in the year 2024 received a D+ and a D-. This begs the question, how are we addressing this, right? And I decided to highlight both of these, not just preventing substance abuse, which is what we're talking about, right? Tobacco use, vaping. Vaping can also mean cannabis use, but supporting mental health. We have found, obviously, that mental health is a strong correlation to vaping and substance use. A lot of what our students have reported using their reason for using vape devices and tobacco products is their mental health. They feel depressed, they feel anxious, they feel nervous, and vaping helps, right? And so it is no wonder that if we are getting a D+ in supporting our mental health for our students, that this is going to have a strong correlation between preventing substance abuse, which received a D-, right? And so Addressing the fact that students are self-medicating. Maybe they are experiencing homelessness. Maybe they are having a rough time at home. Maybe they are experiencing bullying because they are identifying as LGBTQ or because they are a certain ethnicity, right? How do we fill that gap and address healthy coping skills that will turn them away from substance abuse, right? So, one thing that I'm going to ask, which is probably one of the important parts, I want you to take a couple of moments to think about one successful strategy that you are already doing to address health disparities in your school or district. Or maybe you don't work at a school or a district, but you have seen other schools and other districts doing a really great job at addressing their health disparities. Take a minute and then drop in the chat what that strategy is. Right? Maybe your community schools are doing a really, really great job with your unhoused students, which is a large population in your area. How are they doing that? Maybe you are in a rural community. How are you addressing vaping, given that your school system looks different than, say, maybe most of the schools here in the LA urban areas, right? Share with us what kind of strategies are working for you at your site when addressing health disparities. Oh, I like that. Free mobile health clinics, health resource fairs, workshops, food and produce drives. Oh, that's amazing. I love that. And that's all through the community schools grant. Awesome. The community schools is a really great program. Talking about disparities, bringing presenters in to share resources, conducting health events that target specific groups, bringing resources to provide that support. Okay. Wellness Coordinating Council meetings held at high schools, various units, both LAUSD and non-LAUSD. Awesome. Get together to address health needs of students. Yes, kind of those PLNs, particularly students with attendance concerns. Yes, chronic absenteeism is a big problem right now, especially after COVID. Coordinating resources. Okay, so joining alongside already calendared events that are targeting one of these listed groups, so not having to reinvent the wheel, just kind of popping into events that are already created. Oh, okay, so not as to out the student group. I like that. Implementing a life skills curriculum to students in continuation schools. Oh, that is awesome. Parent education workshops, yes, because that's one of the other things too, right? Is like supporting our families, not just the students, but their families as well. Student summits, community resource fairs. Oh, I love it. If anybody wants to save the chat for some of these ideas, feel free to do so, because those are some great ideas. Thank you. Thank you, everybody who shared. If you're still typing, feel free to go ahead and still enter it so that we can kind of take some of these ideas and share them out. But this actually brings me to my favorite part. I always love sharing resources, information, taking questions, all of that. So here are some of the resources I have to offer you. Today was just a quick overview of health disparities within our schools when it relates to tobacco use. General 101 information. But the more exciting part, I think, is our part 2. This is really going to be the application piece. This is going to be the piece where you get to actually take actionable ideas. You will hear from maybe other examples that other schools are doing and try to apply these at your school if you are not already trying them. This training will be an hour and a half. It is on October 17th from 3 to 4:30. So hopefully that fits into everyone's schedule. But just like today, we will be recording it. So it could be available to those who could not attend. But feel free to take a look at our trainings. I'm going to show you where you can find our trainings next. But this will be the part 2 to today's training on addressing health disparities in our schools. This will be presented by Derek Reed, who is with us today, our other senior program specialist. And he's going to talk about what he's seen in some of our schools. And again, give you some activities that you can actually use and apply in your schools and your school districts. This is all the support that we have to offer you. Do not worry, I am going to give you a PDF version of this PowerPoint in a couple more slides where these are going to be hyperlinked and clickable. But if you just can't wait, there are some of the addresses, the bit.ly addresses there. We offer 2P services, once again, in terms of trainings, in terms of support. And so that first one is a Google folder with all the flyers and trainings and support that we offer. The second one is a link to all of our trainings where you can go and read about the training, find out what time it is, when it is, find a flyer, and then how to register. Keep an eye on that page because it is ever changing. Once we add a training, a new one will pop up. So you might want to bookmark that. All of our trainings are free. The third one is our catalog. We do offer free educational materials to schools and school districts within the LA County area. And so that catalog is not only a catalog of what we have to offer, but it also is an order form where you can put in an order with us. The next one is our Canvas resources page. All of our recordings and our past trainings are posted there alongside the slides. So that is a link to how to sign up. And if you are already signed up, it is also a link to take you to the page where you can enter your username and password. Once you sign up and register, you forever have access to that page. You do not have to sign up after that. The next one is our website. All of our website has all of this information there, just kind of like a one-stop place for all of our trainings, our catalog, our services. And of course, as always, if you have questions, if you would like to meet with us, if you would like support from us, please, please, please reach out to us. We are always willing to help. We are always willing to hold trainings virtually, in person, help you with your tobacco use prevention policies. Email us at tupi@lakewood.edu. And specifically for this training, resources that were used, but also resources to point you in the directions of maybe how to address health disparities at your school. Truth Initiative is a really, really great website. That's where some of our data and our video came from today. That website You can learn more about tobacco as a social justice issue. Center for Disease Control, or the CDC, has a website specifically dedicated to different disparities within ethnic and racial groups. We Breathe is a website that is preventing and reducing tobacco use among LGBTQ Californians. They also focus on youth. Amplify is an African American coordinating center, also dedicated to reducing and preventing tobacco use within that community. LCC is the Latino coordinating center, also targeting tobacco use in that community. Spark is Pacific Islander and Asian American Resource and Coordinating Center. And the TCCC is a website to learn about tribal communities, tools, resources, and initiatives to promote smoke-free lifestyles. So feel free to use these resources to help different communities or different populations that your school or your district might be experiencing. And as always, thank you so much for being with us today. As I said, this training is being recorded. So if there was something that you missed, you will get an email with all of our resources, this recording, these PowerPoints. Go ahead and scan that QR code or go to dot.cards/ELLEL, and you can also find the slides there. You can download a PDF version of them. Again, everything is hyperlinked, so all of those resources are just one click away. Thank you so much for joining us today. We hope to see you at our part 2 in October. I hope you have a great day, and if you have questions, we'll be sticking around. Thanks.